Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
What if you could know the real age of your heart? I mean, not just the number of years you've lived, but how well it's actually working.
Yeah, imagine that.
Imagine like a scan that could tell you if your heart is aging faster than the rest of you, maybe giving you a heads up to make changes before any problems even surface.
That's exactly the exciting idea behind the research we're exploring today. Scientists at the University of East Anglia, they've developed this new technique. It uses magnetic resonance imaging to figure out the functional age of your heart.
Okay, let's get into this. We're doing a deep dive based on a health news article from May 2nd, 2025 that reported on this work.
Right. And our main source, though, is the actual scientific paper. It's called Cardiac Magnetic Resonance Imaging Markers of Aging, a multi-center cross-sectional cohort study published in the European Heart Journal Open in 2025.
Okay, so our mission here is to understand, how this new imaging technique works, what the study found about heart aging, especially the links to lifestyle.
And what it could all mean for your heart health down the line.
Exactly. So let's start with the basics. What exactly were the researchers trying to find out? What was the main purpose?
Well, the primary aim was to create a system, an automated one, using cardiac magnetic resonance imaging
Okay.
to predict the functional age of the heart.
Yeah.
But beyond that, they also wanted to look at how known cardiovascular risk factors, things like, high blood pressure or diabetes, how those relate to the heart potentially aging faster prematurely.
So mapping those risk factors to actual measurable aging in the heart.
Precisely. And they also wanted to detail the specific changes both in the heart structure and how it functions that go along with this faster aging.
Okay. And how did they do it? What was the methodology?
Right. So this was a pretty big international effort, multi-center. They had 5 centers involved across the UK, Spain, and Singapore.
Wow, okay.
And they recruited 563 participants in total. These people were split into 2 main groups.
2 groups.
Yeah. First, a derivation cohort. That was 191 healthy people. Normal body mass index, no known metabolic, cardiovascular, or respiratory diseases. This group basically set the baseline for healthy heart aging.
The normal, essentially.
Yeah. Then there was the validation cohort. That was 366 individuals. These people had a body mass index over 25, so overweight or obese, and at least one other health issue.
Like what sort of issues?
Things like high blood pressure, diabetes mellitus, atrial fibrillation, that's a type of irregular heartbeat, or obesity itself.
So they had the healthy group to create the standard, and then this other group with known health conditions to see how their hearts compared. Is that the idea?
Exactly. That's the core idea. For everyone, they used advanced cardiac magnetic resonance imaging, really detailed scans.
To measure what, specifically?
Various things about the heart's structure and function, like the size of the heart chambers, how strongly they pump, that sort of thing. And from the data they got from the healthy group, they developed a specific formula. It used 2 key measurements from the left atrium, that's the heart's upper left chamber.
Which measurements?
The left atrial end-systolic volume, basically how much blood is left in that chamber after it squeezes.
Oh, okay.
And the left atrial ejection fraction, the percentage of blood it actually pumped out with that squeeze.
So how much is left versus how much went out?
Sort of, yeah.
Yeah.
It gives you a sense of how efficiently that chamber is working. They use these to calculate the heart's functional age, and they checked it against the actual chronological age of the healthy people to make sure it lined up.
Made sure the formula worked on the healthy baseline first.
Right. Then they took that same formula and applied it to the validation group, the ones with health conditions, to see if their hearts looked functionally older than their actual age.
Okay, so what did they find? When they crunched the numbers, what were the key results?
Well, first, in the healthy group, just as they expected, the functional heart age from the magnetic resonance imaging was very close to their actual age. The formula worked.
Good sanity check.
Exactly. But here's the kicker. In the validation group, the ones with high blood pressure, diabetes, obesity, their functional heart age was significantly higher.
Higher? How much higher?
On average, their hearts looked about 4.6 years older than their chronological age.
Wow, nearly 5 years older on average. That's quite something.
It really is. So, for anyone listening, if you have conditions like high blood pressure, this study suggests your heart might actually be aging quite a bit faster than you are.
Were some conditions worse than others? Did they see bigger differences for specific issues?
Yes, they did. They found that people with high blood pressure, diabetes mellitus, and atrial fibrillation all had significantly higher functional heart ages compared to healthy folks at the same age.
Okay.
But the link with obesity was particularly, well, striking. They looked at different classes of obesity.
Like levels of severity.
Exactly, and they found a really strong link. The more severe the obesity, the older the functional heart age. For individuals in obesity class 3, which is the most severe category,
Yes.
their functional heart age was, on average, an incredible 45 years older than their actual age.
Wait, 45? 45?
45 years, yes.
That's staggering. I mean, that really puts an exclamation point on the impact of severe obesity.
It absolutely does. It highlights just how dramatically it can accelerate the aging process in the cardiovascular system.
Okay. Did the study also tell us anything about just normal, healthy aging?
It did, yeah. They observed some patterns even in the healthy group as they got older. Things like the left atrium tending to hold a bit more blood, both when it's full and after it contracts.
So volumes increase slightly.
Yes, the end diastolic and end systolic volumes tended to increase. At the same time, the ejection fraction, that percentage pumped out, tended to decrease slightly. And also, how quickly the main pumping chamber, the left ventricle, refills with blood also decreased. That points towards the heart becoming a bit less flexible or compliant as we age naturally.
Interesting. So even healthy aging involves measurable changes.
Definitely. But the changes seen with those comorbidities were much more pronounced and suggested accelerated aging.
This new method, then, it seems like it could give us a much deeper picture of heart health than we had before. What are the bigger implications of this for doctors, for patients, for you?
Oh, the implications are potentially huge. First off, this magnetic resonance imaging technique could become a really powerful tool for doctors to spot heart aging issues much earlier, maybe even before someone has any symptoms.
Early detection. That's always key in medicine, isn't it?
Absolutely. Catching things early allows for earlier intervention, which usually leads to better outcomes.
Makes sense. What else?
Well, it could also lead to much more personalized risk assessment for heart disease. Right now, age is a big factor, but it's just chronological age.
Your birth date.
Exactly. Knowing your heart's functional age could give you and your doctor a much more accurate, tailored picture of your individual risk. It's more specific to your heart.
I can see how that would be powerful.
And think about motivation. If you find out your heart is functionally, say, 10 years older than you are,
That would be a serious wake-up call.
right, it could be a really strong motivator for people to actually make those healthier lifestyle choices, improve their diet, get more exercise, manage their weight or blood pressure. Seeing that number could make it much more real.
Yeah, much more direct than just hearing general advice about risk factors. It's your heart's age.
Exactly. And related to that, this information could help doctors tailor treatments more effectively. If they have a clearer picture of the heart's functional status and how quickly it seems to be aging, they might be able to intervene sooner, perhaps with medication or other strategies, to try and slow down that aging process, potentially preventing things like heart attacks or strokes more effectively.
So better targeting of treatments, too.
Yeah. And finally, it just really reinforces what we already suspected, but shows it more clearly. Conditions like high blood pressure, diabetes, obesity, they do speed up heart aging. It underlines how critical it is to manage those conditions really well.
Okay, this all sounds incredibly promising, but you know how science works. There are always caveats, right? Limitations to consider.
Oh, definitely. And it's important we talk about those. This study, while really interesting, has some limitations. One is the design was retrospective.
Meaning they look back at existing data.
Exactly. They analyzed data that was already collected. They didn't follow the same group of people over many, many years. That kind of long-term study, a longitudinal one, would give even stronger evidence about cause and effect.
But it would take decades, probably.
It would. So this cross-sectional study gives us a valuable snapshot, an association. We can't say definitively from this alone that, for example, high blood pressure caused the faster aging, just that they're linked.
That's a fair point. Correlation versus causation. What else?
There's also something called potential survivor biases, especially with the older participants.
How does that work?
Well, the older people in the study were, by definition, still alive and well enough to participate. They might be generally healthier than others their age who perhaps didn't survive or weren't well enough.
So the older group might look healthier than the average person that age, potentially underestimating the real impact of health issues.
It's a possibility, yeah. Something to keep in mind. Also, the study didn't have super detailed info on how long people had their conditions,
Yeah.
like diabetes or high blood pressure, or other lifestyle factors.
Like diet, exercise levels, maybe socioeconomic status.
Exactly. All those things could influence heart aging, but they weren't tracked in detail here. And of course, the group with health conditions.
Mm.
Many of them were likely on medications.
Right, treatments for those conditions.
And those treatments themselves could have affected the heart aging patterns they observed. It's hard to tease that apart in this kind of study.
Okay. Any other minor points?
Just one small thing. A tiny percentage of scans had to be excluded because the image quality wasn't perfect. It was a very small number, they said, but technically it could introduce a very slight bias.
Right. It's good to have that full picture, including the limitations. Now, what about the experts themselves? What did the researchers who actually did this work have to say?
Yeah, so Dr. Pankaj Garg, he was the lead researcher from the University of East Anglia. He sounded really positive about it. He actually described the technique as a potential game changer.
A game changer. Strong words.
Yeah, for helping people keep their hearts healthier for longer. He said that for people with conditions like high blood pressure or diabetes, their heart is often functionally older than they are. And this method lets doctors, quote, look inside the heart like never before and spot trouble early.
Look inside like never before. That really captures the potential, doesn't it?
It does. And another member of the team, Hossam Asadi, a doctoral student, also expressed a lot of excitement. He hoped it might even become, a standard part of heart checkups someday.
Like a routine scan?
Maybe. So you could catch hearts aging too fast really early on and intervene.
That would be quite a shift.
Definitely. The authors also pointed out something interesting about communicating risk. They suggested that just telling someone the difference between their functional heart age from the scan and their actual age.
Like, your heart looks 6 years older than you are.
Exactly. That simple comparison could be a really clear, straightforward way for doctors to explain why lifestyle changes or managing risk factors are so important. It makes it very personal.
Much easier to grasp than complex risk scores, perhaps.
Quite possibly. And one other point they made, they noted that maybe some of our standard measures of heart function, like ejection fraction.
The percentage pumped out we talked about earlier.
Right. Maybe we need to adjust how we interpret those based on age, because even healthy hearts become a bit less compliant, a bit stiffer as we get older naturally. So a certain ejection fraction might mean something slightly different in a 70-year-old compared to a 30-year-old, even if both are healthy.
So it's not just about finding problems, but maybe refining how we understand normal heart function across the lifespan, too.
That seems to be part of the implication, yes.
This has been really fascinating. A look at technology that could genuinely change how we monitor and manage heart health. It definitely feels like it holds a lot of promise.
It does seem that way.
So as we wrap up this deep dive, what's a final thought for you, our listener, to maybe chew on?
Well, now that we know it's actually becoming possible to measure your heart's functional age, how might that knowledge change things? How might it shift our own approach to preventative health, maybe our sense of personal responsibility for our well-being?
Yeah, what new questions does it raise for you personally about your own heart health journey?
Exactly. It's moving beyond just counting birthdays, isn't it? It's about understanding how old your heart truly is and maybe thinking about what steps you could take, starting now, to help keep it feeling young and strong for as long as possible.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.